this particular study is a very simple study of 30 patients with advanced lung cancer, so stages 3 and 4, and their spouses or romantic partners. So in this study, it was all spouses. And so what we asked was very simple to fill out a questionnaire, cross-sectional study, meaning one time point, and both patients and their spouses filled out questionnaires. So one important measure was they completed the ESAS, which is a symptom measure. So patients filled out their own symptoms and then their perception of their spouse's symptom. And the same thing for the spouses. The spouses filled out their own symptoms as well as the perception of their partner's symptoms or the patient's symptoms. And so then the first thing we did is we looked at the concordance between self-rating and other ratings. So the patients did a pretty good job at identifying the caregiver or the spouse's symptom burden, but the spouses actually overestimated the extent to which patients experience symptoms. And the extent to which they overestimated the symptom burden was related to their anxiety. So the more they overestimated symptom burden in the patient, the more anxious they felt. Okay, so that was kind of the first thing that we looked at. Then the second aspect was, what is the role of communication in this concept? And what we looked at was cancer-specific communication. So to what extent does the patient and the spouse agree in regard to treatment-related decisions? Do they think that they have an opportunity to freely speak about their treatment preferences? Do they see eye to eye in how to manage symptoms? When to be taken off treatment? So there's a standardized measure for that. And the more discrepancy there is, or the more unmet the communication needs are between patients and spouse, the greater symptom burden in patient as well as spouses. So greater cancer-related symptoms for patients, more distress, anxiety, depression in both patient and caregiver.